Hi, I'm Peggy Kelly with the Santa Paula Times, and I'm here today with special guests that we're going to have an update on our own Santa Paula Hospital, a hospital on the hill, and also county services that are so important to our population and our whole community. And my guests today are Dr. Minako Wadabe and also Jody Watson. Uh, Dr. Wadabe is the, explain what your title is.
So yeah, right now I'm the Associate Chief Medical Officer for Santa Paula Hospital and VCMC, as well as an OBGYN in the community of Santa Paula.
That's wonderful. And Jody, your title, ma'am?
Yeah, I'm a certified nurse midwife and a women's health nurse practitioner, mostly doing deliveries out of Santa Paula Hospital and also at Ventura County Medical Center.
God, that's wonderful. Yeah.
Thanks.
Minako, tell us a little about your background.
Sure, yeah. First of all, thank you so much for having us. It's really fun to be on a local channel and being able to talk to the community where we've been working. And so I've been here working in Santa Paula for 10 years now. So I was actually born in Japan, lived, in different cities actually across the globe, and was at UCLA for residency and found this job at Santa Paula and working with Santa Paula Hospital and VCMC 10 years ago. And came out to here to work and have been working in the clinic right behind the hospital for about 10 years. So love the community, have really grown to just love the community and the little restaurants and everything about it. As far as the hospital goes, recently I became more of an administrator and have been doing some of the work in women's health development as well as surgery for Santa Paula Hospital. So I'm really excited to share about all of that. And, in the process of developing women's health in Santa Paula, we found our wonderful midwife, Jody. So, yeah.
Jody, just let me ask you again, just out of curiosity, did you discover Santa Paula and Ventura when you were at UCLA, where you and you got your training through VCMC?
Myself?
Yes.
Yeah. So, I had actually been to Ventura before from when I was living in Los Angeles, but I was really looking for a job out of residency, working with an underserved community or, working actually with in any institution where we never had to turn a patient away, regardless of their ability to pay. And that was really important to me. And so honestly, even in medicine, there's actually not that many jobs where you really have that opportunity. And so I really looked into that. I mean, I wasn't necessarily looking for a geographic area. I was really looking for a place where there was a mission that I felt really strongly about. So that's what brought me to Ventura. My husband's from Los Angeles. I said, hey, we're going to move to Ventura. It's only an hour away. And he thought that was reasonable. And so we've been here now for 10 years, had 2 kids here, and I had both of them at Santa Paula Hospital. So they're very proud to say that they're Santa Paula Hospital kids, and of course, to have delivered many babies at Santa Paula Hospital. So really feel like part of the community now.
Absolutely. And Jody, you are our baby expert today also. And
yes.
Tell me about your background, please.
So I graduated from Georgetown University. I was actually living in Ventura about 7 years ago. My husband is in the Navy, and this was one of our first duty stations. So we lived in Ventura, but I was a telemetry nurse at Community Memorial Hospital. Then we moved to San Diego, and I did graduate school during that time. And when there was an opportunity to come back to Ventura, we grabbed at that opportunity. And it has just been amazing. The connection that I made prior to coming back to Ventura was through Denise Ellison, who happens to be one of the pioneers of the Santa Paula Midwives program. And just like Minako said, there was this mission that really drew me to Santa Paula Hospital. And it has just been a pleasure really to take care of the community and provide midwifery service to this community. And the story behind the hospital and keeping the hospital open, that was something that was truly inspiring to be a part of. I really commend this community's efforts to make sure that their hospital is open. There are counties throughout the United States that unfortunately don't have access to OBGYN care. And so I really respect what Santa Paula did in making sure that this hospital stayed open. And it's just a pleasure to be a part of this mission. It really is a beautiful thing to be a part of. So thank you also for having me here.
Oh yeah, it's a wonderful place.
Yes.
Minako, how would you say we're doing after the COVID surge? I imagine things were very busy up at the hospital during and very hectic and scary, I might add, during the COVID surge.
No, absolutely. I think, as everyone in Santa Paula knows, Santa Paula, Fillmore, Piru have really experienced a disproportionate amount of COVID, loss during the pandemic. And in Santa Paula Hospital, saw a disproportionately large number, care for a disproportionately large number of COVID patients, despite being a small community and being a really small hospital. But the hospital staff, the physicians there, I'm on the OB side, so I was kind of outside of it, but just looking in, I mean, they worked so tirelessly. And it was emotionally really challenging. I think part of being a small community is that many of the patients they were caring for at the end of their lives, they were people that they knew in the community. They may have been family members, their doctors, really people that were close and near and dear to their heart. So the emotional burden of kind of going through that, and really being on the other side of it, feeling much better about it. But I think it really did take a toll in the hospital. But I will say, yesterday I spent all day operating at Santa Paula Hospital, and the staff are resilient, they're strong, they're now thankfully taking care of a lot of people who don't have COVID, have all of the things that we all suffer from, that we're always there for. And so I think we're definitely seeing the other side of it, which is, I can't say how grateful we all are to the community for all the efforts and really trying to take the precautions to get us to where we are. Because between vaccinations and really people abiding by the safety measures, it's really made a big difference. So feeling really optimistic and really feeling like, we were just able to start doing surgeries on all sorts of patients who have been delayed for almost a year now. I would say, women with breast cancer, for example, they had their mastectomy and we were waiting for reconstruction, and reconstruction after, a mastectomy is just such a huge part of the quality of life of a woman. Or, and now we're able to start doing those reconstructions again, because those were, delayed for quite a while. Or people who have had, benign things that really have affected their quality of life, and have been waiting and waiting and waiting for their surgeries, are now able to get them. So really feeling like we can get back on our feet and, and serve our community in the way that we've always meant to do it. And, proud of the community and the hospital for doing what they did during the COVID surge, and just so happy to be back where we are now, with all the recovery.
There were a lot of times that I'd go up the hill to the hospital, and both sides of the street would be lined with signs thanking everybody that was at the hospital and delivering meals and trying to do whatever they could do to basically help them out. And that was wonderful. The support will always be in everybody's heart for medical first responders and people even that just work in hospitals. Everybody was risking their lives for us, and I know it was emotionally draining, and I sympathize with all of you. It was, it just is. Now, let's talk happy talk, babies. Jody, tell us, let's talk happy. Let's get happy.
Yes.
Now explain exactly what the program is up at the hospital as far as the midwife program goes.
Yes. So the midwife program is 24/7 midwifery coverage for anyone that is looking for a low intervention, high touch birth experience. Your midwife can take care of you for your prenatal care and follow you all the way up to delivery. In addition to that, Denise and I, we are doing a lot of outreach services within the community. And in fact, we have one coming up on May 1st. Denise has coined the phrase grass gathering. And essentially what that means is that we meet on the lawn in parking lot A, right by the helipad overlooking the mountains. And it's free to the community. And this next forum that we have coming up on May 1st at 11 o'clock is focused on the postpartum period. And we're going to have amazing speakers. We're going to have a newborn care specialist. We're going to have doulas. We're going to have someone for physical therapy to talk about your pelvic physical therapy and pelvic care. We'll have someone from the mental health department to talk about postpartum depression. We'll have a breastfeeding lactation expert there to talk about breastfeeding. And it's called the fourth trimester, which is a very important time after having a baby. And so we want to just make sure that we're covering all our bases. So from prenatal care to labor and postpartum. But, you know, our goal, the Santa Paula Midwives, our goal is to create an in-hospital birth center experience. We have had patients that are coming, I mean, from far, from Simi Valley in Los Angeles, just to come and have their baby at Santa Paula. And once they get there, they're just so impressed by how caring everyone is, the fact that it's a small town, it's in a beautiful location, it's not a very busy place, and so they get that one-on-one care when they're there. Fortunately, we've been able to establish the nitrous oxide there at the hospital, which is another a non-medical way of coping with pain in labor. We just set up our queen size bed. You know, you can fit a whole family on that. And we also have our labor tub for moms that may not want to have an epidural, but also we have the features of the hospital as well too. So it's a great medium for families that are looking for maybe like a low intervention environment, and they always also want that birth center feel, but also want the access and the accessibility of our OBGYN staff and our emergency services. So
Now,
that is our program.
Are you finding that more and more people are asking for this now? They're interested in this now?
Yes, they are.
Very good.
People are really, really excited. The trouble has been really getting the word out. And so we're creating flyers. We're reaching out on social media. You can follow us at Santa Paula Midwives on Facebook and also on Instagram. And if you're interested in any of our services, you could reach out at Santa Paula Midwives at gmail.com. But people are really, really excited. They just don't know about it. And we just can't wait until the community finds out. Because, you know, for instance, we've had families that maybe mom wanted to have the baby at home and dad's like, I don't know, you know, this is truly a happy medium and for a lot of people. And so we're excited about it, and families really are excited about it as well.
Because most people think midwife, they think home.
Yes.
They don't see that you can have midwife services and that
Right.
intimacy and actually be in a different setting other than your home. So
yes.
Santa Paula, which I know is at the forefront of many things, is Santa Paula, basically one of the Santa Paula Hospital, one of the first in the county to go this route, or one of the leaders in the county to go this route.
Truly, we are leading in that for sure. There are other places throughout California that have this model. While I was in San Diego, I was able to see the UCSD in-hospital birth center. And so we're trying to definitely create and model, you know, our facility after that, and really create this hybrid for moms and families. So, but we are definitely leading in that aspect.
Yes, absolutely. Yes. And of course, San Diego, that's a very, very large place with a huge population.
Yes.
You know,
right.
So that's wonderful. I think that's that's marvelous. Now, we have special resources that we have for patients. I think the doctor was talking about earlier when I spoke to her in person. What kind of or is that midwifery also?
Well, yeah, I think Jody spoke to some of the classes that she has for perinatal classes. Jody's done such an incredible job of transitioning to our world in the pandemic and not being able to do, you know, have 20 pregnant moms together in the same room doing birthing classes. So she's created a Zoom birthing class, which has been interactive and, you know,
Yes.
well attended, and is a live class, so you don't feel like you're just watching a video.
Yes.
So I don't know, Jody can explain it better,
Yeah,
definitely.
absolutely. It's free, first and foremost. You won't find anything like it anywhere else. It's a free class. It's 6 hours. It's broken up over a 3-week period. We have it in English and Spanish, most importantly, and we're running it all the way through the rest of the year. We're actually actively doing our Spanish class this month, and then we'll be rolling into our English class, our English childbirth class. We cover everything from the prenatal visit to labor, postpartum newborn care. We have speakers through public health, some of our own OBGYN, our family practice doctors that come and answer questions. And it is live and it's vibrant. And we encourage our families and support people and your doula and whoever, even if you're not pregnant, we just come get some information about this, you know, so. Yes, and our childbirth, our classes, you can find them on our social media pages as well. We're constantly posting that information. Again, that's Santa Paula Midwives on Facebook and Instagram. Just throughout, I mean, through the Ventura County website, also will have the classes posted as well too.
All the links and everything.
Yes.
The county's got an excellent website.
Yeah.
They really do. Now, while we're talking about pregnancies, we'll switch a little to the mothers. The issue of vaccine, I know that that's something new now, that they're giving vaccine to pregnant women. So,
yeah, no, it's really important topic, because I think, you know, when the vaccine first came out, you know, it said, well, you know, we didn't do the studies, we didn't include pregnant women in the studies. So, you know, there was a lot of uncertainty. Should pregnant women get this vaccine? Should they not? What are the risks and benefits? And so there's been a lot of work on this since the vaccines were created. They first became, you know, available to healthcare workers in December. So now it's been, you know, 4 or 5 months where we've had some data from all of the healthcare workers that were vaccinated, but really good, just looking back at the science, looking at a lot of detail about how these vaccines work and how the maternal fetal, you know, circulation works and immunology and so forth. It's really been thought that, you know, believed through all of the women's health organizations, whether it be the American College of OBGYNs or maternal fetal medicine, that the benefits of the vaccine likely far outweigh the risks, the potential risks. At this point, we don't know of any risks. I have an incredibly close colleague who was just a few weeks pregnant when the vaccine came out, and she had it. And I think all of the healthcare workers that I've cared for have, I think at least, you know, probably the vast majority of them, I don't know if anyone has refused it. Just knowing that, you know, the severity of the disease, if you do become ill with COVID during pregnancy, is so severe. And, you know, the risk that we're talking about is a potential risk. Like we don't really have any mechanism where we're thinking that this would likely be harmful. So we are definitely recommending it because everything is risk benefit, you know, discussion, you know, like we're talking about the risk of COVID, compare that to the risk of the vaccine. So we always have to think about how we're making these decisions. But yeah, we came up with some resources for frequently asked questions. You know, a lot of women go, wow, I heard on the internet that it causes infertility, you know, and so the specialists in infertility went into this and looked at it and looked at the mechanism of how the messenger RNA vaccine works and looked into the science behind it. They said, you know what, that mechanism that they're talking about doesn't make any scientific sense, you know, and so all of those myths have really been debunked. But I think, you know, the internet is a place where there's a lot of information out there, a lot of misinformation, unfortunately. And so, you know, I think, and I totally understand how patients, how the community gets scared, like seeing these things, you know, like you spend enough time on the internet, you're terrified. But unfortunately, a lot of that is not, you know, a lot of it's not based in truth. So that's been one of the toughest challenges, is trying to balance and saying like, hey, you know, like we understand there's lots of information out there that seems really scary. Like this is what we really, you know, this is what, as a scientific community, as a medical community, as midwives, these are the things that these are the sources we rely on. And these are the reasons why we feel like, you know, this is that we recommend this, that if I were pregnant, I would want to be vaccinated. I was vaccinated. I'm not pregnant. No secrets here.
Now to hear if you are, you know.
Right? It would be kind of cool, but.
Oh, that's wonderful. Yeah. Well, and I know that they have had cases where women have been pregnant and became infected with COVID, and their babies were born with COVID. Haven't there been a few cases of that?
Yeah, yeah,
Mhm.
definitely. So yeah, and women who, when you're pregnant, you know how you're always breathing a little bit faster, your lungs are always working a little harder, right? Because you're breathing, you're essentially breathing for two. It makes it really difficult. So when you're going up a hill, even like getting dressed in the morning, you start to get a little out of breath. And that's one of the reasons why COVID is so dangerous in pregnancy, is because your lungs are already like running a little marathon. And so now you're going to put the stress of a really, a virus that really impacts your lungs. Now you're compounding that. Now you're already on a marathon, and now you're getting sick. And so that's the reason why COVID is so dangerous. And women who contract COVID during pregnancy are more likely to end up in the ICU, more likely to even pass away from COVID than women who are not pregnant. So
Mhm.
definitely an important thing to consider.
Absolutely. And I really wish there was a clearinghouse, and I imagine there probably are, that say that people have to learn to check the facts type of a thing. But they do have, and unfortunately, COVID has demonstrated more misinformation, I think, than most other subjects in the history of the world, because we have that means to spread misinformation.
Yeah.
Let me ask you, were you surprised at how bad COVID got in the United States? Even Ventura County did so great for so long, and still is. I know it's still an example of a county that, escaped a majority of the problems, but still we got hit hard too. But I mean, did you personally find that surprising?
I guess it's mixed. We saw what happened in Italy, remember, back in
Yes.
March of last year, and just seeing what they went through, looking at what happened in some areas of Asia. And I think, one of the benefits of having access to so much information is that we did get to see what we were up against
Right.
early on, because we had this information from other countries. So I think from that standpoint, the medical community, we were really prepared. I mean, I think starting in March, we had meetings every morning about COVID and how we were going to approach things and how we're going to keep people safe in the hospital. All of the safety protocols, the cleaning mechanism, what's the newest information today about, how to keep people safe. So I think from that standpoint, we did anticipate it, and we were really prepared. I mean, it was an incredible miracle that we were able to suppress the pandemic for so long, because that March surge did not get to, it was actually flattened pretty quickly. And then we had that little surge in July, and then really got tough again after Thanksgiving, after all of those gatherings from Thanksgiving. But I would say I'm probably not so surprised initially, because we were so prepared for it. I think, we did a pretty good job of being all prepared, and thankfully we had a lot of preparation for the December surge. But I would say nobody can prepare you for kind of the emotional, challenges that are faced when you're, in a community, especially a small community where people are really being affected personally.
Yes,
So,
we also lost a colleague with Dr. John Schrock.
yes.
I know, and he was a dear man. Yes.
He absolutely was. And we work in the same office, and just kind of walking, by his office every day. And I know, the office staff where, they would share the same screener, and, Mark, our front office person, is just so heartbroken, saying,
Well, and he
don't.
went out, warning people, and a physician to the end. He really was.
He really was.
Humanitarian to the end, because he wanted people to know the dangers and all that. So,
Yeah,
you know.
absolutely. Yes. Yeah. No, his last little piece where he shared his experience was just really powerful.
Yes, absolutely.
Yeah.
Is there anything I didn't ask either one of you or either one of you, whatever, that you would like to bring up, or anything on your mind? We're more than we welcome any of your comments or thoughts.
No, I think we covered a lot. I just want to, again, say thank you for having me. I am appreciative and humbled to be a part of the mission of this community and to really serve the people in whatever capacity that we can. Santa Paula midwives are here to serve. And so please just keep in contact with us, touch bases with us if there's anything else that the community would like to see from Santa Paula midwives.
Okay, that's wonderful. And we really appreciate it. How about you, honorable doctor?
Yeah. Thank you. Yeah, no, just so appreciative to be here, and just want to remind the community that the hospital is open and that, the emergency room is there to serve us for any any concerns, emergencies that we may have. I think a lot of people have been really afraid to go to the hospital, thinking, that this is going to be like they're going to actually get COVID at the hospital. And I can assure you that you will not. I mean, I think there's so many safety protocols in place, and the doctors and nurses are so incredibly well versed in safety and so ready. They're there to take care of you, and we don't want people delaying care. Really severe, horrible things. We've seen a lot of really late diagnoses of things because people have hesitated to go to the hospital. So just want to remind the community to take care of yourselves, to take care of your families, and just make sure that you reach out for care if you need it. And we're all here for you. So thank you so much for having us.
Thank you so much. And once again, I'm Peggy Kelly, and with the mighty Santa Paula Times, I might add. And this was a hot update from Santa Paula Hospital. I'm splashing back to the original hospital here. And joining us today was Dr. Minako Watabe. Did I get that close?
Minako Watabe. Got close. It's all good.
You pronounced it better than I did. Who would have thought? Jody, very much nice to have you here, Jody Watson.
Thank you.
And ladies, I hope this is just the beginning of more visits.
That would be wonderful.
Absolutely.
Thank you so much, Peggy.
And thank you so much. Everybody out there, we brought you a nice update from the hospital. We hope to have more of these. Our health is very important post-COVID, and because a lot of people actually haven't been taking care of themselves, as was pointed out just now. Be sure to have a wonderful weekend. You can watch this on Spectrum Channel 10, kadytv.com. Go to YouTube. If you're on YouTube, be sure to subscribe. It helps us bring more broadcasting. And also the county will be posting it hopefully on several of their sites. And there's no such thing as not knowing enough about what your medical services are right here in the Santa Clara River Valley. And we thank these two gals for their dedication to the community. And everybody have a COVID safe weekend. And thanks again. Bye-bye.
Thank you.
Thank you.
Thank you.